So good evening, everybody. I'm Anthony Bardos. I'm the chair of IET Berkshire. And tonight we've got Dario, I'm not going to say the name right, I should have checked, Cargogo, who's a biomechanical engineer at the at University College London, and where he's also a lecturer in pharmaceutical nanotechnology and nanofabrication. And he's going to be giving you a talk tonight on drug delivery systems. Over to you, Dario.
Great. So thank you very much, Anthony, for the kind introduction and for the invitation to present today. So my name is Dario Carrugo. As Anthony mentioned, I'm a lecturer at the UCL School of Pharmacy within the Department of Pharmaceutics. My work is very much in applied engineering. So in our group, we develop engineering technologies to deliver drugs more effectively, as well as for regenerative and intervention pharmaceutics. My educational and research background is in biomedical engineering. So today's presentation will focus on the use of ultrasound waves, specifically in therapeutic drug delivery applications. So the aim of this presentation is to provide you with an overview of the fundamental principles and applications of ultrasound in drug delivery. And I'll specifically cover briefly some fundamental principles of ultrasound waves and ultrasound propagation first. I'll then introduce some classes of ultrasound-responsive drug carriers with a particular focus on microbubbles. I'll then present some applications of microbubbles in drug delivery. And at the end of the talk, I will also discuss some alternative agents to microbubbles which could be used to improve therapeutic efficacy. So let's start by covering some fundamentals of ultrasound propagation. So let's consider a rigid cylinder that contains a gas, and this gas is driven by an oscillating piston on the left-hand side. So we are specifically now considering the case of a longitudinal sound wave. So longitudinal waves are waves where the particles within the medium are moving in the same direction as the wave propagation. So if you focus at the surface of the piston, you'll notice that we can observe an alternation of high pressure, where particles in the medium are pushed closely together, and low pressure, where particles are separated one from each other. And this alternation of high pressure, low pressure propagates along the cylinder. And that's what we refer to as a pressure wave. So we often characterize these pressure waves by adopting a sinusoidal kind of function. And that's because it's quite convenient from a mathematical point of view. So we can characterize the properties of the wave by introducing some convenient mathematical parameters. So for example, the wavelength, which is the distance in meters between 2 points of the wave which have the same phase, for example, 2 maxima. C is the speed of sound, which is another important property. T is the period, which is basically the duration of a cycle, and F is the frequency, which is the number of cycles per second. These parameters can be related one to the other. So for example, the wavelength is defined as the speed of sound multiplied by the period, or the speed of sound divided by the frequency. Now, in this talk, I'll be discussing about specifically ultrasound waves. And ultrasound are a type of sound waves which are frequency greater than 20 kilohertz. For the specific case of applications in drug delivery, a common frequency range is between 0.5 and 2 megahertz. We can also consider most tissues within the body as water-rich. So quite often, we can approximate the speed of sound in a tissue, and that's certainly the case for soft tissues with the speed of sound in water, which is about 1,500 meters per second. And that means that the wavelength of these ultrasound waves is in the range between 0.75 and 3 millimeters. So this gives you some kind of orders of magnitude in terms of the key parameters that characterize ultrasound propagation in tissues. So in this previous animation, the sound source was an oscillating piston, but when it comes to applications of ultrasound in drug delivery, the sound source is a piezoelectric element or piezoelectric transducer. So these transducers are made of materials which are able to convert electrical energy into mechanical energy. So for example, if we apply a potential difference across the material which takes a sinusoidal shape, in most cases, this will be converted into a pressure wave, also taking a sinusoidal shape. So it's very important to understand how ultrasound propagates through materials of different properties, particularly when it comes to medical applications of ultrasound. And that's because, for example, if we wanted to deliver ultrasound to a target tissue deep within the body, which could be a tumor, for example, as in this image, that ultrasound wave will have to cross, for example, skin, a layer of fat, and muscle tissues. So it will have to cross different types of tissues and potentially organs which have different characteristics and different ways of interacting with the ultrasound wave that we generate extracorporeally. So one parameter that defines the resistance that a material offers to the propagation of a sound wave through it is what we call characteristic impedance. And it's the product between the material's density and the material's speed of sound. So let's now consider an ultrasound wave, which we call incident wave, that is traveling through a medium 1, which has an acoustic impedance Z1 equal to ρ1 C1. So this material has a density ρ1 and a speed of sound C1. So what's likely going to happen when this wave encounters an interface with a second material is that part of this wave will be transmitted into the second material and part of this wave will be reflected backwards. So I should say also that the second material may have a different acoustic impedance Z2 equal to ρ2 C2. So there are some kind of mathematical parameters that help us understanding what is the proportion of the incident wave that gets transmitted as opposed to the wave that gets reflected backwards. And these are the pressure reflection coefficient and the pressure transmission coefficient. So without looking into the mathematics of these purely from a qualitative point of view, it's important to note that when the acoustic impedance of the two materials is comparable, most of the wave will be transmitted. So from the first material into the second material. When there is a significant mismatch in acoustic impedance, there will be a significant reflected component of the wave. I should also say that these coefficients are called pressure coefficients because they relate the acoustic pressure of the incident wave that hits the interface between the materials with the acoustic pressure of the transmitted or the reflected wave. So if we look at the acoustic properties of materials which are of interest to our applications, so we're talking about different types of tissues, what you can see is that soft tissues, for example, liver, the kidney, or muscles, as well as fat, have got quite a comparable acoustic impedance here on the right-hand side, and also a comparable speed of sound. And as we said before, this is due to the fact that these tissues substantially behave similarly to water. As you can see, the speed of sound of water and the acoustic impedance are not far from those of these tissues reported here in blue. So, and these are, as I mentioned before, referred to as soft tissues. Hard tissue, such as dense bone or cortical bone, instead has a significantly greater acoustic impedance and speed of sound and density as well, which means that if an ultrasound wave is traveling through soft tissues and then encounter hard tissue such as bone, it is likely that a significant proportion of that wave may be reflected backwards. Air has a very different acoustic impedance and of course a very different density. And ultrasound doesn't travel efficiently through air. So delivering ultrasound to tissues such as the lungs, for example, which are filled with air, it's a significant challenge. So if you go back to the domain that I presented earlier, so this rigid cylinder, which is driven by a piston on the left-hand side, and this time we consider a slightly different configuration where the right-hand side of the cylinder is a rigid boundary. So this, for example, could be the case of an ultrasound wave that travels through soft tissue and then encounters a bone, or a hard tissue. So what happens in this case is that the incident wave generated by the piston is likely to be completely or partially reflected at the rigid boundary. So we will have, a wave traveling backwards, which interferes with the wave generated by the piston. And this interference generates a much more complex acoustic field. As you can see below, the displacement and the pressure fields within the medium are slightly different from the ones we've seen before. Without going into too much detail, what we can notice is that there are regions where particles do not displace at all. And these are also characterized by maximum pressure, whether it's positive or negative pressure, or regions that instead where the particles undergo maximum displacement, but they present minimum pressure. So this type of field is referred to as a standing wave field, or ultrasonic standing wave field when we talk about ultrasound pressure waves. So the regions of minimum pressure are also referred to as pressure nodes, and the regions of maximum pressure are referred to as pressure antinodes. So this is the type of field that may occur when, for example, we're trying to deliver ultrasound to a bone or a bone fracture. So as I mentioned before, when ultrasound travels from soft to a hard tissue potentially. Although, in a clinical setting, it will be much more complex than the one reported here. So one interesting effect of these ultrasonic standing waves, when they're applied to a suspension of particles, which could be a suspension of cells, is that they exert forces on these cells. And these forces can be used to manipulate cells on demand. So for example, here you see an experiment we carried out in our lab where we suspended very small particles in the order of 2 micrometers. So it could be comparable to our red blood cells or smaller than that, suspended in a fluid. And we're then generating a standing wave field within this medium. So what happens is that the particles will have a tendency to move from the pressure antinodes, so the regions of maximum pressure, to the pressure node in the center, which is the region of minimum pressure. And you can see that once ultrasound is activated, that results in effective manipulation of the particles towards the center of the channel. So this type of acoustic field, although it could be of interest from the perspective of delivering ultrasound within the body, also has some interesting avenues of application in terms of cell manipulation and particle manipulation, particularly for cell separation and biodetection. But this could potentially be the subject of a completely different talk. So let's now try to look at how ultrasound could be beneficial in drug delivery. And before we do that, we should first introduce some concepts that relate to drug delivery or drug administration within the body. So one way of delivering drugs, which is also a very common way, is to inject them intravenously, so within the circulatory system. And this is often referred to as systemic administration. So let's assume that we are administering a drug in this way, but ultimately what we want to do is to treat a tissue which is located within this purple circle here. So as I mentioned before, what's going to happen is that the drug is going to travel within the circulatory system and ultimately reach the small capillaries, which are the smallest blood vessels within the body, throughout the body. So capillaries are those blood vessels which are deputed to the transport of substances between the blood vessels and the surrounding tissues. So for example, nutrients, waste products, gases are all transported at the capillary level. And the same applies to drugs. So because we administer the drug systemically throughout the body, what's going to happen is that the drug is going to ultimately diffuse from the capillary into the tissues. But this is going to happen more or less everywhere within the body. So it's going to diffuse into our target tissue here, but also in other regions which are not of interest to us from a therapeutic point of view. Which means that we will get some off-target distribution, and also means that there is a tendency then to increase the drug concentration to ensure that we ultimately obtain a sufficient concentration of drug where we want it to be. And this leads to, of course, toxic side effects on patients. Another important aspect to consider is that the transport of drug from the capillaries into the surrounding tissues in this particular way of administering drugs is driven by diffusion predominantly. So diffusion is a mechanism of transport that follows the concentration gradient or the concentration difference. So the drug will move from regions of high concentration to regions of low concentration, but it's not a very effective way of delivering drugs. In fact, if we look at this microscopic image of a biological tissue, what you can see is that the therapeutic agent, which is labeled in green, is confined to the proximity of the blood vessels of the capillaries, which are labeled in red. The target tissue here most of it is unaffected by the drug. So that means that the drug is really confined to the proximity of the blood vessel. It's not penetrating efficiently throughout the target tissue that we want to treat. So an alternative approach to achieve localized and enhanced delivery is to use ultrasound activation. So in this alternative approach, we are again administering the drug intravenously, but together with the drug, we're also administering an ultrasound-responsive carrier. So it's a carrier which transports the drug, but is also sensitive to ultrasound. So we then use an extracorporeal ultrasound source, which, as I mentioned before, would be a piezoelectric element, for example, to deliver ultrasound to the target tissue that we want to treat. And this will ultimately result in the release of the drug just where we want the drug to be located at the right time point as well. So this way of localizing delivery allows to reduce the off-target distribution of the drug, enables also to use the use of lower drug doses potentially, and in addition to that, also allows for greater penetration of the drug within the tissue as opposed to a diffusion-based mechanism of delivering drugs. So the underlying hypothesis is that when we co-administer the drug, which is represented by these green dots here, together with ultrasound-responsive particles, which are in purple, upon activation of these particles, there will be some mechanical effects which promote penetration of the drug more distally within the target tissue. I should also highlight that, so before we mentioned about capillaries being the region of the circulatory system where transport of substances occurs. So for a drug to reach the target tissue, it has to cross the wall of these capillaries. And one layer of this wall is made of endothelial cells. So the endothelium is practically a barrier for the transport of drugs into the surrounding tissue. It's a barrier or a way of controlling the transport of drugs or other molecules. So, and we know that this approach works effectively because if we go back to that biological microscopic image I showed before, and now we compare the case of an ultrasound activated therapy to the case of a non-ultrasound activated therapy, you can see that the drug, again labeled in green, has been able to penetrate much more distally within the target tissue away from the blood vessel compared to the more conventional way of delivering therapeutic agents. So I mentioned about these ultrasound sensitive particles. So let's now look at which type of particles are normally used in these applications. So the most common one is represented by gas microbubbles. So these are spherical particles with a gaseous core, which is stabilized by a coating layer. So the coating layer is made of molecules which are referred to as amphipathic molecules. So in simplistic terms, these molecules contain two key parts. They contain an hydrophilic head, where hydrophilic means something which has high affinity for water, and an hydrophobic tail, which has very low affinity for water. So what happens is that the hydrophilic head will tend to face water, so the outer environment, while the hydrophobic tail will tend to face the gas core. That's why this coating layer, so that the molecules in this coating layer form this monolayer with this particular arrangement. So the coating layer provides stability to the microbubbles. It prevents, for example, or reduces the rate of diffusion of gas from within the bubble into the outer medium. So the core itself is typically made of heavy gases, so they have a relatively they present relatively slow diffusion into the outer medium. The coating is typically made of phospholipids, which are widely used in drug delivery systems, as well as denaturated proteins. And the diameter is between 1 and 10 micrometers, so they can only be observed using an optical microscope. Bubbles which are greater than 10 micrometer cannot be administered intravenously because they may cause embolism, so they may occlude the small capillaries within the body. So how are these microbubbles generated? So they could be fabricated in different ways. A very common way is through high intensity mechanical agitation. So what we do, we prepare a liquid solution of the material which makes the coating of the microbubble, and then we just agitate it at very high power. So this method is very cost effective and high throughput, but leads to microbubbles, as you can see, with a very broad size distribution. So it may need some post-production processing to remove, for example, the larger bubbles. Another alternative methods is microfluidics. So we can use microfluidic devices to generate bubbles that this time have a very controlled size. So for example, these devices, 3 inlets. So we inject water in the lateral inlets and a gas stream in the central inlet, and the 2 lateral streams of water will break the central stream of gas into individual bubbles. So this method offers great control of the bubble size, but devices are complex to fabricate and the production rates are particularly low. So this area of microbubble production in itself is an area that merits further development and research to identify a method that provides both control over the bubble size as well as leads to sufficiently high production rate for industrial scalability. So now that we have produced the microbubble, we need to think about how we can load a drug, so a therapeutic compound, onto the microbubble, or which kind of delivery strategy we use. There are different options. So one option could be to incorporate the drug into a nanoparticle, so something smaller than the microbubble, and then attach this nanoparticle onto the microbubble shell. So this approach could be quite convenient if one, for example, wants to protect the drug from the blood, the constituents present in blood, or for preventing an immune reaction. Another strategy is to bind the drug directly to the microbubble shell, for example, using electrostatic interaction. Or one may want to just co-administer the microbubble with free drug in solution, so it doesn't need to be necessarily attached to the microbubble. So for instance, in our group, we have looked at different, loading of different compounds, including genetic material, which is very much of interest now, considering that it's part of some of the COVID vaccines, as well as the antibiotic gentamicin. And we often load the drug together with a fluorescent molecule, which allow us to use fluorescence microscopy to confirm that loading has actually occurred. So all these microbubble images show that we can detect a fluorescent signal from within the shell of the microbubble, or the surrounding of the microbubble shell. So now that we've loaded the microbubble with a drug, we should think about how microbubbles can respond to an ultrasound wave, or vice versa. How can we use ultrasound to activate those microbubbles? So in order for a microbubble to be able to expand, the pressure within the bubble should overcome the surface tension, which holds the microbubble together, as well as the pressure, the hydrostatic pressure of the surrounding liquid. So I should say that, of course, the reason why microbubbles respond to ultrasound in the first instance is that they've got a gaseous core, and being the gas itself highly compressible, that provides the acoustic responsiveness that microbubble offer. So as I said, so the pressure inside the bubble should substantially overcome the surface tension in order for the bubble to be able to expand. So once the bubble starts expanding, it also has to overcome other forces, and particularly it has to overcome the inertia of the surrounding liquid, as well as the viscous losses due to the viscosity of the surrounding liquid. So there will be some energy losses due to the fact that the liquid in which the bubbles are placed, which could be blood, for example, present a certain viscosity. So when ultrasound exposure continues, the bubble will undergo alternating expansion and contraction. And this response is referred to as cavitation. So you may have heard about cavitation in fluid mechanics as the formation of gas bubbles when the pressure basically drops below the vapor pressure. And that, cavitation can be quite problematic because it can damage, hydraulic components. In the specific case of ultrasound, drug delivery, ultrasound-responsive particles, cavitation is referred to as the behavior of a microbubble or of an agent upon exposure to the ultrasound. So as I said before, if you apply an ultrasound wave, the bubble will undergo periodic expansion and contraction. And that's particularly the case when the acoustic intensity is relatively low. So what we see is that the bubble undergo what we refer to as stable cavitation. So when the pressure rises, the bubble will compress. When the pressure reduces, the bubble will expand, and this could happen with a certain periodicity. At greater acoustic intensities, the bubble may instead behave very non-linearly and potentially collapse. So collapse happens when the bubble contracts very rapidly, and the inertia of the surrounding liquid basically overcomes the ability of the bubble to expand back again. And both these type of cavitations will induce potentially very different biological effects, because one may think that stable cavitation induces more gentle effects compared to microbubble collapse or transient cavitation. So let's look now at how this particular behavior of a microbubble could be used to control the release of a drug. So research has shown that once microbubbles are activated and therefore they undergo this oscillatory motion, that also leads to the release of the payload. So this video, for example, shows that upon ultrasound activation, the content from the microbubble shell is propelled into the medium. So this could be a very convenient way of timing the release of a drug at a specific location within the body. It has also been shown that it's possible to control the directionality of release. So this particular video shows a cell in red with microbubbles in green. And when ultrasound is activated, the content from the microbubble shell, so potentially a therapeutic compound, is pushed against the cell. So, and this is achieved by tuning the ultrasound field characteristic to obtain a certain directionality of release. So great, so this shows that microbubbles can be used as a delivery system which enables controlled release of a payload, of a therapeutic payload. But how does that result in better, also, delivery efficiency, in better penetration of the drug within a certain target tissue? So this could be, greater delivery efficiency could be due to different mechanisms. And just to mention a couple, so the first one is what we call microstreaming. So when a bubble undergoes that stable oscillatory motion, what it does, it practically acts as a micropump. So it's able to impart momentum to the surrounding liquid and generates vertical flows in the form of counter-rotating vortices, as shown in this image here. So what we do in our lab, we build microfluidic devices which we can couple with a microscope, so we can observe at the right scale what's happening to the microbubbles as well as the surrounding fluid. So in this particular experiment, what you see here are fluorescent microparticles, which we use to trace the fluid, so to understand how the fluid moves. So we're not looking at the bubble, but what's happening around the bubble. Actually, the bubble will be located here in the center of the vortices, but we can't see the bubble because it's not fluorescently labeled. So as you can see, once ultrasound is activated, as the bubble oscillates, it drives this motion, this vertical motion in its vicinity. And it's quite surprising the fact that although the bubble is very tiny, so we're talking about 1 to 10 micrometer in diameter, this motion interests a very large region in comparison. So we're talking about few millimeters. So this means that this fluid motion can really enhance delivery of a therapeutic compound. And in this case, it won't be diffusion-dominated delivery, but it will be very much a convection type of, of mechanism, of transport mechanism. And also, this fluid motion can impart mechanical stress on a tissue, which could be beneficial for various therapeutic reasons, as well as in enhancing the permeability of a tissue to a certain therapeutic molecule. So in addition to microstreaming, a second mechanism that can help delivering drugs into a tissue, into the cells of a target tissue, is what we call sonoporation. So this has less to do with the stable oscillation of the bubble, but more with the second type of cavitation regime that I've discussed before, which is the one that leads to bubble collapse. So what I called transient cavitation. So this video shows that when a microbubble in very proximity to a cell collapses, this can cause the formation of pores within the membrane of a cell. And these pores enable effectively greater delivery of drugs into the cell. So in the video, the microbubble will appear as a white dot. And as you can see, as soon as the dot collapses, so the bubble collapses, a pore is formed within the membrane, and then the pore reseals. And resealing is very important because it maintains cell viability. Great, so now we looked at what is the potential of microbubbles in terms of achieving controlled release of a drug, as well as enhancing uptake of a drug into a target tissue. I will now describe some potential applications of this therapeutic approach. So research has been done covering a variety of applications ranging from anti-cancer therapy, breakage of blood clots, antibacterial therapies, treatment of neurodegenerative diseases, repair of bone fracture and immunotherapy, and more. And these different applications, of course, are at different stages of research or clinical translation. Some of them are at a clinical trial stage, some of them are recruiting for clinical trials, some are more at fundamental laboratory research stage. So I'll now cover the first 4 applications among those one mentioned here. So there is significant evidence that microbubbles combined with anti-cancer drug can significantly reduce the growth of tumors. So in this particular study, basically the combined use of microbubbles, ultrasound, and the anti-cancer drug gemcitabine was investigated as a treatment modality against pancreatic cancer. And as you can see, the size of the tumor over time increases significantly less when compared to the anti-cancer drug alone, so gemcitabine alone. Another application is for the treatment of neurodegenerative diseases, for instance, Alzheimer's disease. So in this application, the rationale is to use ultrasound with or without microbubbles in order to permeabilize the blood vessels within the brain. So it's very similar to the concept I presented before, with the main difference that the blood vessels within the brain have a very packed endothelial layer. So endothelial cells in those capillaries in particular are very tightly connected. And that's very important because it protects the brain from, from toxic metabolites and other exogenous, toxic compounds. So the opening of what we call the blood-brain barrier can be quite difficult to achieve, and particularly it has to be reversible because we don't want to damage the vasculature of the brain permanently. So there's been a significant research in this area showing that indeed the application of ultrasound and microbubbles can enhance delivery of compounds into the brain. So in this image, you can see on the left-hand side, the treated region compared to the control. And again, this experiment was carried out using a fluorescent molecule so that, that kind of enhanced penetration of the drug could be visualized. And studies have also shown that actually this permeabilization effect is very much reversible over time. And that kind of level of reversibility depends on the ultrasound stimulation characteristics. So how is ultrasound applied to the brain? But there can be many different ways, ranging from more invasive, for example, a single element transducer implanted into the skull or an array of transducers. Or it could be a less invasive approach where we have an array of transducer with water as a coupling medium, or a single element transducer, again, using a coupling medium. So ultrasound has shown to be particularly beneficial as well in breaking down blood clots. So it could be used as a strategy to basically treat conditions such as deep vein thrombosis or pulmonary embolism. And if you think about what we discussed before in terms of the way in which microbubbles respond to ultrasound, these kind of mechanical responses in terms of the volumetric oscillation of the bubble, the microstreaming that can induce, or the effect of microbubble collapse that can all contribute to the lysis of a blood clot. So for instance, previous in vitro studies have shown that when comparing the use of just a pharmaceutical compound called TPA, which is tissue plasminogen activator, it's a very common thrombolytic compound, so it's known to lyse, to basically break down blood clots. When we compare this administration method with the combined use of ultrasound and microbubbles with, again, the drug, the effect of microbubble and ultrasound in enhancing the breaking of the blood clot and the lysis of the clot is very significant compared to the control, the more conventional therapy. And this is particularly relevant because TPA and these classes of drugs are very toxic. So if we can enhance the lytic effect of the treatment, we can also reduce the concentration of TPA that we use, and this can significantly reduce toxic effects, side effects on patients. I should also say that there has been a clinically approved device for sonothrombolysis, which relies on a slightly different approach. So it doesn't rely on extracorporeal ultrasound stimulation and administration of microbubbles, but instead on an intracorporeal approach. So as you can see, the device consists of a catheter, and within the catheter, there is a central core, which contains a series of transducers generating the ultrasound wave. Within the catheter, there are also other kind of lumens for delivering, for example, a drug, a thrombolytic drug, or for delivering a coolant, which keeps the temperature of the transducers controlled. So this catheter is typically inserted in proximity or within the clot itself. So it's a very kind of localized administration of the ultrasound itself. And the final area of application that we are particularly interested in is the one that uses microbubbles and ultrasound to treat infections, bacterial infections. So in this particular study, what we did is to load an antibiotic onto a microbubble. And the rationale was to administer those microbubbles to the bladder in order to treat urothelial infections. So the urothelium is basically the inner lining of the bladder, which can be infected, so bacteria can penetrate within the tissue. So ideally, what we want to do is to enhance the delivery of the antibiotic within the tissue to treat the infected tissue itself, so the infected cells. And as you can see in these microscopic images, when we apply ultrasound, which is the image below, there is much more effective intracellular delivery of antibiotic compared to the control, compared to antibiotic alone. And this also resulted in significantly greater bacterial killing compared to conventional therapies. We are also interested in administering ultrasound topically for the treatment of infections in chronic wounds. So chronic wounds often occur, for example, in diabetic foot ulcers and can significantly compromise the wound repair process. So this device is a rapidly prototype system which enables us to deliver microbubbles onto the surface, so the skin of a patient, as well as ultrasound. We have tested it in vitro using bacterial models or biofilm models, which are common in chronic wounds. And what we have seen is that by applying ultrasound and microbubbles, which is the images below, we can remove significant amounts of biofilms, which is labeled in green, as well as kill the remaining bacteria. Great. So in many of the applications that I've discussed before, ultrasound is often applied using a focused transducer. So focused transducer is a particular type of transducer which is able to focus the sound field into a narrow region, and this region could be potentially in the order of a few millimeters. Focusing can also be achieved using an array of transducers, and one benefit of this approach is that the focal region can also be moved. So different areas of a tissue could be treated. So focusing of the ultrasound practically provides localization of the therapy, and that's because only the microbubbles which are exposed to ultrasound will respond and deliver the therapeutic payload. However, there may be particular applications where we also want to increase the number of microbubbles that reach a certain region within the body. So we need to localize more bubbles to improve treatment efficacy. So for example, if we want to treat a blood clot, a challenge is that the blood flow within a clotted vessel is very low. So it will be quite difficult to accumulate sufficient bubbles in that particular region simply because the blood flow that transports the bubble is very low. So we need ways of somehow accumulating bubbles in those regions. So one way is to, for example, incorporate magnetic particles within the bubble shell, and then use an extracorporeal magnet in order to basically trap those bubbles at the target site. So in this study with collaborators at Oxford, we actually designed and developed a magnet which is coaxial with a focused transducer. So the magnet is in light gray and the transducer is in green. So what this device can do, if applied extracorporeally, it can basically trap microbubbles which contain magnetic particles and then activate them simultaneously at the site of trapping, providing highly localized delivery. So I've covered few applications of ultrasound in drug delivery, but then an important question to consider when developing those therapies is, how do we make sure that microbubbles respond? So that's not too complicated to do in a laboratory setting. For example, we can grow cells onto a device and then apply microbubbles, use a microscope and observe what's happening. It may seem simple, but the challenge is that if we want to resolve the oscillation of the microbubbles in time, we need to use acquisition frequencies that are typically greater than 1 million frames per second. And that's because of the oscillation frequency of the microbubble. So in itself, it's quite a technological challenge. So in this video, for example, you can see the microbubble oscillating nearby a cell and imparting a deformation onto the cell membrane. However, we can't do this within the body. And that's because we cannot gain optical access in the same way within a patient. However, microbubbles come to our favor because as the bubble oscillates, it also generates another pressure wave itself. So it generates a secondary pressure wave. So the primary pressure wave is the wave we are sending in, while the bubble oscillation generates a secondary pressure wave. And this secondary pressure wave can be captured using, again, a transducer that this time works as a receiver. So it's not generating a wave, but is receiving a mechanical signal and converting it into an electrical signal. And we can process this signal, for instance, by looking at the frequency content of the signal. And what you can see is that because of the nonlinear nature of the bubble oscillation, this signal will contain multiples of the stimulation frequency as well as fractions of this frequency potentially, and sometimes may also contain some broadband noise. So ultimately, the signal that the bubble generates contains some distinct signatures that allow us to determine whether the microbubble is responding to the ultrasound or not. So that's very important to ensure that the treatment is actually working as we like to. And using arrays of transducers, what we can do also is not just collect a signal at a single point, but we can map the signal generated by microbubbles in a spatially resolved way. So for instance, these color maps here show the intensity of bubble oscillation or intensity of cavitation over a certain domain. And this map is overlaid with a traditional diagnostic ultrasound image. So what we can do in this way, we can identify whether the bubbles locate where we want them to be, but also we can monitor whether they are responding to the ultrasound as we like to. And in this particular slide, actually, if we go back to the magnetic targeting approach I mentioned before, what you can also see is that if we compare microbubbles on the normal microbubbles on the left-hand side to microbubbles that have been accumulated or targeted using a magnet, you can see that the intensity of cavitation is much greater for those that have been targeted using the magnet. And that's because we were able to accumulate more bubbles at that particular site where the magnetic field was applied. So this approach that combines therapy with the ability of monitor therapy or diagnose, it's called theranostics, which is kind of the combination of therapy and diagnostics. So I've presented several potentials of microbubbles as a tool in drug delivery. However, microbubbles, they also present challenges, and these challenges relate to their limited stability at body temperature, and also to the fact that although they are very small, they are not small enough to penetrate themselves within the tissue. So the activity of the bubble is very much confined within a blood vessel. It's, the effects of this activity are very helpful, but they could be even more helpful if the bubble would be able to penetrate within the tissue. So one way of achieving that is to develop smaller particles. So particles which are small enough to extravasate, as we say, so to transfer, across the wall of the capillaries into the target tissue. And one class of particles which we are particularly interested in are liquid emulsions. So you can think about this particle as oil in water emulsions of a very small size, in the order of 200 to 300 nanometers as an average diameter shown here. So being very small, these particles can extravasate, so they can pass through the gaps between the endothelial cells, and they can reach the target tissue, which could be a tumor, as in this image. However, one challenge again is that because they're made of liquid, they're not able to respond to an ultrasound wave as the microbubbles do. And that's because, the liquids are not as compressible as a gas. So they won't be able to respond and perform all these different kind of mechanical effects that we discussed before. So in order for these particles to respond, we need to convert them into something which is acoustically responsive. So something that contains a gas, for example. So one way of achieving that is to use very volatile liquids as the constituent of the nanodroplets. So for instance, perfluorocarbons. So what that enables is the fact that when the pressure is lowered, remember the ultrasound is a pressure wave, so it's an alternation of high pressure, low pressure. When we reach the minimum pressure, if that pressure is sufficient to vaporize those nanodroplets, then we would be able to convert them into a microbubble. And once they are converted into a microbubble, they will be able to expand and contract, release a drug, and also promote drug penetration within the tissue. And this image shows that it's a comparison of, again, a microscopic image before and after ultrasound application, showing that those nanodroplets are indeed capable of converting into a microbubble. In the image on the left-hand side, you can't distinguish the nanodroplets because they're very small, so the microscope resolution is not sufficient to detect them. And this video actually shows that vaporization process being recorded by collaborators at Oxford. As you can see, initially, it's very difficult to distinguish any pattern within the image because the droplets are very small, so in the order of 100 to 300 nanometers. But as soon as ultrasound is activated, you can see that bubbles form. So that phase transition from liquid nanodroplets into gas microbubbles occur. You can also notice that there is almost like a pulsating phase transition. It's not like a continuous process. And that's because in many medical applications of ultrasound, particularly the therapeutic ones, ultrasound is applied in a pulsed mode as opposed to a continuous wave to kind of reduce potential heating or kind of for safety reasons. So just to conclude, I've shown that microbubbles, so gas microbubbles, have potential as carriers for controlled and localized delivery of drugs into the body, that cavitation of microbubble is a way of controlling the release, also enhancing delivery of drugs within a target tissue. We've looked through different applications of this therapeutic approach, including anti-cancer and antimicrobial therapies, as well as blood clot lysis. And also, we have briefly looked at nanoscale agents as an alternative to microbubble to improve their ability to penetrate within a tissue and deliver drugs more effectively. So thank you very much for your attention, and I'll be happy to take any question.
Hi, thank you very much, Dario. That was absolutely fascinating. So we've got a couple of questions in the chat. If anyone has any questions, put them in the Q&A, and we'll see them, and hopefully Dario will be able to answer them for you. Is absorption of the wave an issue as well as reflection?
That's a really good question. So definitely the absorption of the wave is also an issue that needs to be considered. And of course, there are tissues that will kind of offer greater absorption compared to others. So definitely that's something that we need to consider when we, particularly when we set the amplitude of the ultrasound wave, because ultimately we need sufficient pressure in order to be able to induce cavitation, in order to oscillate those microbubbles. And also, depending on the type of cavitation that we need, we may need even greater pressures if, for instance, we want to achieve collapse. Quite often in our research, we first perform kind of fundamental kind of laboratory research to understand which type of acoustic field is required to achieve a certain therapeutic effect. So for some application, more intense kind of responses such as collapse may be preferred. And therefore, that what we need to do is to monitor the response of the microbubble and tune the input parameters accordingly. And that also would account for potential absorption as well with the ultrasound wave.
Okay, got a question here. When an ultrasonic wave passes from one medium to another, is there a change of direction, refraction of the wave?
Yeah, so yeah, definitely it's a very good question as well. So of course, the schematic I presented is a fairly simplified schematic. It's a specific case of also of a wave that hits an interface between two materials in such a way that is perpendicular to the interface. But in reality, changing direction can occur, and also the wave may hit a certain target with a certain angle. So that's something that also we should know. We normally consider. We often perform a computational modeling where we are trying to understand, how ultrasound travels through a certain target tissue. We use modeling also when we develop, for instance, a system that we use in the lab, kind of an in vitro system to before we go into more complex models. But yeah, so that refraction can potentially occur depending on the acoustic properties of the media. And that definitely needs to be considered because it may affect where ultimately our focus ends up being located.
Okay, thank you. What magnetic field strengths are required for focusing the delivery?
That's a very good question. So in terms of the trapping efficiency, it's the field gradient is the more kind of dominant factor compared to the field strength. So the way we design our system is to ensure that, or our magnet in the particular case is to ensure that we have sufficient field gradient in order to be able to exert a force, a magnetic force onto those particles or onto the microbubble that is loaded with the particles. So it's more of a field gradient challenge as opposed to a field strength. Now, having said that, the small magnet I showed in the slide, it's suitable mostly for superficial applications. For example, if you wanted to treat a fairly superficial blood clot. So if one wanted to translate that concept into the clinic, that of course that would scale up in terms of dimensions. So one may actually want to use clinical MRI machines. So there's been already work that has been looking at coupling MRI with ultrasound. So that kind of would require different scales in terms of magnetic field gradients that could be generated if one wanted to treat tissues that are deep within the body. Yeah, so that system was very much kind of custom developed. And what we also did is we tried to develop something that could be quite user friendly. So it was made of permanent. It's practically an arrangement of multiple permanent magnets as opposed to use an electromagnetic field or a more complex system, which would definitely be required if one wanted to scale up to a clinical application for treating deep tissues.
Okay, thank you. And I think this looks like the final question. You mentioned the MP implosion can create micropores in the adjacent cell for greater drug absorption. Would this generate temporary or permanent damage to the cell?
It's a really good question, and actually, it's one of the challenges that that people working on sonoporation that they often look at. So the reference I mentioned in the slides, I'm very happy to share it, actually covers this exact topic. So what I have shown is that the acoustic stimulation conditions are very important because that would affect the way the bubble behaves and also the size of the pore that is generated. It's not just the acoustic field properties, but also, for instance, things like the distance between the bubble and the cell. So the distance between the bubble and the membrane ultimately affects the magnitude of the force which is imparted on the cell membrane. So there have been, basically what the study shows is that up to a certain size, the pore is able to reseal back, so the membrane can reseal, and the cell maintains its viability. Above a certain size, the cell doesn't reseal, and that will lead to cell death. The resealing process in itself is a very interesting kind of research area, because what it has been kind of hypothesized and shown is that the cell actually recruits lipid vesicles that travel all the way from the inside of the cell to the membrane and fuse with the membrane in proximity to the pore, and that helps resealing the pore. So there is very much a biological response. So it's not purely kind of a physical process. It's very much a biological response involved, whereby the cells tries to practically deliver lipids to close up the pore. I suppose that it's a combination of physical and biological factors, but what it has been shown is that if the pore is too large to start with, the cell struggles to seal it.
I've got one more question. Have you looked at the lymphatic system and lymph nodes and development work in this area for treatment of lymphoma, and use of this in your work?
I haven't personally, and actually it's a really good, I think it's a really good suggestion. I don't think that the particular area of lymphadenoma treatment has been really explored as much as other areas in relation to the use of ultrasound-based therapies. So it's certainly something that I'd be very interested in looking at and see whether there is potential for this type of kind of physical therapies. In this area, it's certainly something that has been more overlooked compared to other applications.
Okay. Well, thank you very much, Dario. That looks like the end of the questions. It's been a fascinating insight you've given us there. And well, thank you very much.
Great. Oh, thank you, Anthony, for the invitation, and everyone for attending as well.
Thank you, everybody. That's the end of tonight's talk.